I'm Dallas Carter, and my chosen topic is intellectual disability. I'm talking about health concerns today. So, description of population. The defining characteristic of intellectual disability is limited ability to learn that impacts daily function. The CDC says about this, intellectual disability is a term used when there are limits to a person's ability to learn at an expected level and function in daily life. Intellectual disability could cause a child to learn and develop more slowly than other children of the same age. It could take longer for a child with intellectual disability to learn to speak, walk, dress, or eat without help, and they could have trouble learning in school. So this kind of is from the CDC. It kind of talks about children, but this can put someone with an intellectual disability behind from childhood on, and it can kind of set them back a little bit in some of these important abilities that we kind of require in society to have success. So, size of population with disabilities, the numbers on this weren't great from what I could find. In Weber County, I was able to find numbers for disability in general, which is 18%. That's including physical and other disabilities. In Utah, 10.9% of the population has a cognitive disability, which cognitive disability is a little bit broader range than intellectual disability. But for the United States and world population, I have some better numbers. About 65 million in the US and 1 to 3% in the world population have an intellectual disability. So, talking about contributing factors, social determinants of health. The barriers that I identified include economic stability and healthcare access and quality. The reason I list economic stability as a major one is because it can be difficult to find a job that provides good financial support without having a good education, and people with an intellectual disability will have a harder time getting a high education. Healthcare access and quality similarly has to do with education, health literacy. I say education access and quality needs to be modified for these people because someone with an intellectual disability can still have access to education and a quality education, but they may need to use a non-traditional or special education. For their needs. Other ones, the other social determinants of health include neighborhood and built environment, social community context. These really depend on the support system that a member of this population has. And there are resources that help people with intellectual disability to have housing and try to be able to function independently as much as possible. And depending on their support group, it really depends on what their neighborhood built environment is. Some of these people end up living with their family for longer than most of the population. And so that is part of what influences that. Other contributing factors, specific concerns are that intellectual disability affects education, and that can influence economic instability, which has an impact on the other social determinants of health. What sort of access they have to healthcare and access to other services like that. Root causes for this population is that intellectual disability creates a knowledge or functional deficit that kind of creep into all aspects of life. So, Maslow's hierarchy of needs, I would say that it's important for people with an intellectual disability to have their physiological needs met. That's really important that they have a good support system early in life. If they do not have a parent or guardian who is supportive and capable on their own, then it could really set them back. However, if they have a good support group and their physiological needs are met and their safety needs are met early in life, then their chances of being able to achieve the other needs are greatly increased, and they're totally plausible for anybody in this group, I would say. So belonging, love, esteem, and self-actualization, these are all things that are within reach for somebody with an intellectual disability, if they're given the means to kind of have a fair start at the beginning of their life. Other concerns, diseases or infections. So infection control, I've just put in here kind of as part of health literacy, making sure they understand, the disease process and how to prevent disease. That goes along with STIs. Safe sex practices are important. It's important that they understand them. Risk factors for acquiring intellectual disability include meningitis, whooping cough, and measles early on in life. Non-communicable diseases that often coincide with intellectual disability include motor deficits, seizure disorders, sleep disturbances, mental illness, and visual and hearing impairments. Self-care and self-harm. So self-care deficit is a common risk factor for people with intellectual disability. Just a matter of, it depends on, how severe their disability is. It can really affect the way they take care of themselves. Some people are very capable still of caring for themselves, while others might not understand the importance of things like personal hygiene or other self-care practices. Also, there is an increased risk of self-harm, and in people with these disabilities, like I mentioned before, mental health problems can be common. Risk for harm by or to others. So there is a big risk in this population of neglect and abuse early on if the parent or guardians of someone with an intellectual disorder does not care for them, which unfortunately does happen and is more common among people with intellectual disorders, then that can obviously affect their health very adversely. So one study shows that children with intellectual abilities have 3 times higher risk of abuse and 5 times higher risk of sexual abuse. As far as aggressive behaviors in this population with intellectual disability, about 1 in 4 adults tend to have aggressive, challenging behavior. And these are the references for the sources of my presentation.